Many times we take caregivers farther and farther away from the root reason why they became clinicians to begin with. In the cast, the patient and the family were always at the center of everything that we did. That if you put the clinician at the center of your thought process, and you give them the tools, the support, the infrastructure, then they will in turn do the very best for the patient. And they feel like they have permission to go above and beyond.
We're all about the patient. We're all about finding ways to help our patients. Hospitals are in business, as it were. What sets one apart from another is everything. Our holistic program that we have here is something unique to UMC. Tranquility at UMC is an integrative therapies program. We use holistic modalities in addition to the prescribed medication and treatments that our patients are getting.
There's more to being healthy than just taking a pill. Nutrition, exercise, there's different techniques out there that can be used with Western medicine, put that patient in the best position to self-heal.
They're all research-based, so we use these modalities to help patients feel better. Healing does not happen in a stressful environment, and we can measure that with cortisol levels and blood pressures and heart rates and things like that.
There's 1,500 chemical reactions that happen in our body when we're stressed. That chronic stress leads to chronic inflammation leads to chronic disease.
Whatever we can do to get rid of that stress helps you physically, mentally, psychologically, and emotionally.
If we can stimulate the relaxation response, their blood pressure calms down, their heart rate calms down. That helps them heal.
You know, the old saying that you don't come to a hospital to rest is practically true, and it takes deliberate effort to create that kind of restful environment. But the CARE channel for us was a way of giving patients a healing environment.
The CARE channel fits squarely with our philosophy here at UMC. It's designed around stress reduction.
Just focusing on the CARE channel can help bring down somebody's anxiety level. And we've actually seen patients' blood pressures change, their heart rates change.
You can see their body relax. You can watch their monitors that are monitoring their vital signs, and you can watch them change.
The CARE channel for us is a gift that we give patients and families. It's given us a way to create an environment that wasn't so easy to create before.
I have to say I didn't believe in it when it first came about. Once I started using it and I saw the response that the patients had and the patient's family specifically, I was able to control my room with greater effect. Then I realized I was able to wean the sedation more effectively with a calmer environment. That was for the patient's benefit.
The fewer medications you can put on board, the better off the patient's going to be. All medications have side effects. Now we have to handle that side effect. So if we can use more natural modalities to help relieve pain and anxiety, those don't come with a side effect.
A lot of our patients are on ventilators. The music helps to keep them more relaxed as an anti-anxiety, so that we're able to get them off the ventilator quicker. If we can get them off of the ventilator, it will overall decrease their length of stay.
The difference between regular programming and the CARE channel is it helps promote wellness. That's what we're all about.
Because when you're watching a program, you're not lost in the program, you're following a story. It will distract you, but it won't calm you. Whereas with the CARE channel, there are no expectations. Your mind wanders, and that is what calms you down. When we turn the CARE channel on, we leave it on, and we can leave the room and the music is still playing, and they're still having that effect.
It's an active treatment intervention. It's part of the plan of care. In my mind, the difference is pretty clear. The CARE channel was created to be therapeutic.
CARE channel is probably one of the single best investments we've ever made.
This is something from UMC we purchased to help you heal, to reach everybody in the whole hospital. Patients, staff. To us, it was just really a no-brainer. It made sense.
And we're finding that patients are healing faster, Our rate and recommend for the hospital has improved. They feel like they're getting more rest, and they feel like they have more control over their own environments. I knew if I allowed clinicians to tap into their talents, to make some of their ideas a reality, that we were only going to get better. We just didn't know how much better we were going to get.
I'm very proud of where we're at. We are the first hospital to have a tranquility program, to be looking at holistic care. I think we're the place to be.
Having this extra program has made such a difference on every level.
The whole culture of this hospital has changed, and I believe a lot of it has to do with the CARE channel.
Get the CARE channel. Any other hospital would truly benefit from this.
So it really helps my job, and I think that makes me a better nurse. I use it on all my patients.
I think every hospital in the world should have this. It's a no-brainer.
I'm a believer. I'm on board. You know, I've drank the Kool-Aid, so I'm here.